Happy New Year, everyone, and it's Suzanne again, sharing some of my BMT journey with you, my bone marrow transplant journey, stem cell journey, and what I want to talk about is graft versus host disease of my skin. Graft versus host disease, what is that? That is when the new grafted stem cells that become your new immune system attacks the body or the tissue of the body of the host. The body is the host that it enters. And I have 4 areas of my body it has attacked, but the skin is one of the most obvious. It's not often the most dangerous, but it's the most common one also. So most people, if they get GvHD, who have had a bone transplant or a stem cell transplant, if they get it, they'll get it on the skin. Sometimes it's only a few weeks. Sometimes it's the problems last for years. Some people, it might be light, just a little rash, and it goes away after a few weeks, and it doesn't bother them that much. And some people have rash, which often what you get is thickening of the skin, and it thickens on joint areas and restricts the muscles and restricts movement. There are people who have actually not been able to walk because of the graft versus host disease of the skin. That areas it thickens up and tightens up and tightens up the muscle in that area. So people can have it way worse than me, and some people fortunately don't have it or have it much less. So I'm just sharing my experience with you, okay? So what I have is called interface dermatitis, and just to give you a closer look, okay, basically how it started, which you don't see it now because it's developed, is that all over my face it was red and like a rash all over, and for some reason around the center of my eye didn't have it. And little spots, but it was mainly red and thickened skin, especially in the center here. Okay, that's how my face was, and that usually means that the immune system is actively attacking my skin. I also had it, and I still have it, all along my neck, my chest, my belly, my back, and my feet. Let me show you my feet. How do I have it on my feet? Well, this is from severe edema, which is water retention, trying to find places to come out of the body, and it came out in big blisters. And notice the left side of my foot is where the blister was much worse, because it was much bigger. It's high. I couldn't wear shoes for a few weeks when I had it, the 2 to 3 weeks, and it popped. And even when it popped, because it was so sore, that's when it was really, really painful, and my whole foot was swollen, so I had to wear like surgical slippers. So this came, and believe me, this is I'm going to tell you where it came from, but this is very, very improved to where it started, because the skin was dark and thickened when it was healing. And you can see this on Facebook on my page called My BMT Journey. I will be putting up an album to show you where I started from and the progress, and as it even gets better I'll add more. Okay, so yes, where that started from was after I went in the first time, I had to go back in the hospital second time because I had GvHD of my acute GvHD of my liver and my kidney. So to combat that, the doctors gave me a high dosage of prednisone, 65 milligrams in the morning, 65 in the evening, 130, and it gave me severe edema. I was swollen from underneath my breasts all the way down to my feet. I have the elephant looking feet. Kind of like Nutty Professor, how he went poop poop on that fat type of thing. That's how I looked. But my stomach was big, hard, like I was 9 months pregnant. My butt was big, massive. My thighs were big. My calves, my foot, my feet. I mean, it was frightening. I didn't take any pictures then because it was like I was horrified. And the doctors, you know, they're frightened. So many doctors coming in trying to figure out what to do, put me through tests. They were going to aspirate my stomach. Then they realized they could just give me water pills. And from that, it started to dissipate. However, I got the blisters on my feet. And, you know, the water pills had side effects. One gave me lethal levels of potassium. That was another dangerous problem. So then they had to take that out of me, find a way to get the potassium out of me, and so on and so on. But anyway, so my feet are much better. I'm telling you, it's not raised or anything there. And I've had biopsy on my feet, biopsy on my right here by my ear, so they could test what this was. Biopsy on my lip because I got lesions on my lip. One of the things they worry about is skin cancer. Patients who will get graft versus host disease of the skin are at high risk for skin cancer. So they wanted to make sure, I had this for 6 months, that it didn't become cancer, and it was benign. So it's just the graft versus host craziness. They don't even 100% understand really why it acts in the way it acts. There's still a lot of things to be researched and learned. So this is why we need a lot of nonprofit. One of the reasons why, and for treatment. So okay, so my BMT doctor first recommended I just use cortisone on my skin because generally this helps with inflammation, and some graft versus host disease causes inflammation and dehydration, which causes inflammation throughout the body. So this wasn't quite doing that much. So then he decided to prescribe 2 steroids, 2 ointments. One was for was, because I don't use it anymore, for my face, and the other one was for the rest of my body. Obviously, the stronger one was for my body. And then he recommended that I see a dermatologist, and this dermatologist, he is experienced years of studying, had a lab where they studied, researched graft, and I think they still have it, but I'm not sure, but I know for years he's done it, and that's his expertise in graft versus host disease of the skin. So he had me take the one that the bone marrow transplant doctor had me use on my body. He had me use it on my face, and then he prescribed another topical treatment, and it was a gel. This gel, and I was to use it on my feet and on lesions in my mouth. And this shows you how different it is in the world of the bone marrow transplant. A lot of things they do is experimental. Most dermatologists and doctors will tell you anything topical should not go in anywhere internal, only external. However, the bone marrow transplant doctors will tell you to use some of these things internally, like on lesions inside of your mouth or internal places that have lesions or sores. So that's what I did with this, and with this, which is called Protopic. This is an immune suppressant of the skin. I've been using immune suppressants from I got the bone marrow transplant orally, pills, but this one is one of the skin. The reason I didn't get it for months is because the co-payment is $150, which I thought was crazy. And now I realize I didn't even need this large tube that he prescribed because I didn't use a lot of it. But anyway, I gave in, and it helped. Some of this, I think, from time or whatever I used, just started to get better on its own. It just had the discoloration, the darkness. But where you know it was active is where it was red and still thickened, which was the center area. So I kept using this in those areas that I would see redness and thickness. And then the new cream that the dermatologist formulated this is a bleaching cream. So I use that all around the edge, anywhere where it's inactive, and use this in the middle where it was active. And then when this not cleared up, but where the activity cleared up, then I started to use this and stopped using this. So now I don't have to use this. I don't see thickness and red anymore. So it seems all inactive. And now I'm just using this every night, once a day every night. And next month when I see the dermatologist again, he's supposed to reformulate another cream, the same thing, but add retina A to it. He just wanted to see how I reacted to this first. So there's the end in sight. This has gotten better. My pictures have shown it. That's why I take pictures, so I don't have to guess or listen to what other people say. And I definitely 100% know that my feet have gotten better, because you'll see on Facebook. I'll have the album made and put up within a couple of days. So that's what, 6 different things just for my face. So please go to my page on Facebook, my BMT journey, so you can see what's going on with me and other patients, because I put up information that's just general about bone marrow transplant patients, survivors, that world, treatments, diseases, hospitals, programs, things like that. That's what I put up. And I've started a nonprofit called Circle of Love BMT Society. So Circle of Love is a nonprofit I started. I've just been developing. I'll just say it's still in development, because it's not ready for donations, so I don't have the money for the programs yet. But as soon as the website is ready, it'll be on my page, and you can donate, you can read, so you can become aware of the whole BMT world. And for BMT patients and survivors, they can see places where they can get resources to help them in their journey. Okay, so I would like you to support me in that. And because there are many, not just health challenge, but financial challenge, that's why I started it. And I knew that because of my personal challenges myself. So I still have a fund to help me. It's called, GoFundMe is the name of the website, but my link is www.gofundme.com/3UAUU8. Okay, so you can go to that, help in any little way, and follow my page, and when the website is ready for the nonprofit, that's when everything's done. You can go there, donate, learn, share, and so on. And I thank you very much for your time. You know, as you see me with my eyes here, I tell you that one of the things the doctor wants us to do is keep out of sunlight. Well, that's because it aggravates graft versus host disease. Also, we easily get skin cancer. We have a high risk of skin cancer when you have graft versus host disease of the skin. And since I have GvHD of the eyes, I'm sensitive to light. So any light bothers me, but the sunlight is the worst. So I can tell you that. So thanks for listening, and have a beautiful and blessed day.